Hello, fellow HIM5340 students. My name is Sean Weber, and today I'll be presenting on theoretical foundations. With the increasing complexity in healthcare and the growing body of knowledge, information technology is being utilized more and more as a means to help healthcare providers and physicians to make their decisions with the support of data collected and algorithms that help them in the diagnosis and treatment of patients. Items that are helping, especially now, is computerized provider order entry, which assists in actually submitting orders for medication and medication administration, and also the clinical decision support system, which is an algorithm that helps based on the diagnosis or the chief complaints that helps make recommendations for the treatment of the patient. And with that being said, the need for globally trained healthcare professionals is growing. There's a lot of variability when it comes from country to country, especially what technology is used, the standards that are applied to that technology, and also how it's actually overall used. One of the indicators that really signifies this is a study of the healthcare access and quality metrics. There's a lot of variability, especially around countries that are bordering countries. So in focusing only in on Canada and the United States, the variability can be seen by geographically bound countries such as Canada at 88 and the United States at 81. Those are both index scores. And although that there is different ideological approaches when it comes to healthcare, such as universal healthcare or private healthcare, there's also different payment groups and all of that. However, when it comes to actual access and quality, I think this is something that can be universally compared from country to country. And I'm not saying that information technology can necessarily make everybody equal, but I do think that with standardized training and globalized training, that this can, in essence, create a field where if somebody were to travel from the United States to Europe or to Asia or to South America, having technology and having a trained workforce in place where you could seamlessly send patient information from the United States to South America or to Asia could really assist in the overall quality of care, reduce on duplicate efforts such as duplicate tests, and to make better quality decisions because you have all the information required to make diagnosis and treatment decisions. And I think information technology could strongly assist in that regard. So some training topics or approaches that I think would be important. First and foremost, I think the training needs to be developed along with the andragogy approach. The andragogy approach is adult style of learning. Some of the key components include presenting the material in a way that draws upon prior experience, because we'll have many healthcare professionals in there from many interdisciplinary professions. This information in a way that is interactive, where you can have physicians or nurses jump in and state how their previous experience using X and Y led to this. You can also have information technology personnel jump in and say, we think that this will work this way through the different means. Also, one of the first things that I think needs to be done is I think there needs to be a health and information literacy needs analysis. And it might sound kind of productive to ask a physician or a nurse, what is your health literacy? Because of course it would be very high. And conversely, to ask an information technology professional about his or her information literacy. However, having the two together in this class or this training, I think would really provide a good dialogue between how it's being utilized from a healthcare provider standpoint and how it's being developed and implemented from an information technology standpoint. So I think having this discussion between these two groups could really benefit the system, the organization, and healthcare as a whole. One of the barriers to global information technology training is the lack of standardized technology from country to country. Obviously, different countries are going to have different levels of information technologies, different systems. Whether or not those two are compatible is another barrier. But we've been working a lot lately, and by we, I mean the healthcare community, and developing a lot of different standards. One of those standards is Health Level 7, although this is only one component of the overall system. Health Level 7 is working to make transfer of patient information from one organization to another organization a little bit more seamless. And this is really important for healthcare providers to understand, because if you're able to have the full background of the patient, you're able to make better decisions based on whatever diagnosis you're trying to look at. A third piece of information that I think really needs to be looked at is understanding data as a whole. And one of the models that can really assist with this is the Nelson model, where Nelson breaks it down into 4 different categories or hierarchies of information. And those 4 categories consist of data, information, knowledge, and wisdom. The reason I think this is so important is you need to be able to differentiate between the different systems that are implemented or put in place within organizations. So if you're looking at a pharmacy system or a laboratory system, those 2 systems mostly only focus on data and information. Conversely, if you look at a computerized or a decision support system, clinical decision support system, those types of information systems are really going to rely on knowledge and wisdom to help providers make the best decisions for outcomes, treatments, diagnosis. And one of the last things that I think needs to be covered is defining the characteristic of a system. So just going over the basics of discussing how there's open systems, there's closed systems, talking about how for open systems, they focus on 3 main components, which include purpose, structure, and function. Although purpose and function might differ between organizations, I think that they're going to go along with their mission statement. And I think healthcare providers that have a basic understanding of both the system, the structure, and the purpose and the function of the system will really go a long way when providers jump in there. If you understand the function or the purpose of a system, it can help you kind of select which information system is going to help you for your specific purpose. And then when you throw in the Nelson model in there as well, you now not only know the purpose and the function of the system, but you also know what kind of data elements or what kind of information or wisdom is behind the logic that is developed within these systems. So with international travel and pandemic diseases on the rise, especially now the coronavirus going on around the world and spreading from place to place, having a better trained healthcare professional population with the ability to seamlessly send and receive patient information is critical to providing quality care to patients international. And another kind of IT or informatics piece that's linked to the coronavirus that wasn't really discussed in my paper in this training was the use of informatics or the use of epidemiology, actually applying where all of the positive testing has taken place, the spread of it, using systems or using applications such as Tableau or R to actually determine in heat maps where positive tests are coming from, where other ones are coming up, aggregating that data, looking at mortality rates. So I think this is another big piece as to why global trained healthcare professionals, it's kind of on a standardized basis, maybe not standardized in the technology, but the training as a whole can really have an impact and kind of maybe not completely eliminate, but certainly mitigate or reduce the spread. And if there is going to be a spread, then we can send patient information. We can send information about how many outbreaks are over here in this country or how many outbreaks are over here in this country. And we can work together as a whole to try and mitigate or minimize the risk or the spread of disease in the future. If you have any questions about this presentation, my paper, or my poster, please post to Trax. I will get back to you as soon as possible. And thank you for viewing.